Clouds and discussions going on with 2 minutes. Are you all ready? Have the YouTube comments please type in yes or ready or
Yes, Father.
that you please. Am I audible and visible at you? Shall we begin? Greatest enemy is time management. Yes. Josina, yes, Josina Joy, greatest enemy is time. Time management is not our enemy, then there is nothing called time management. Time automatically manages itself. Once you develop competency, you kill the time, you defeat the time. And signature is our smile. Sanjana seems to be, come on, seems to be new face. You have to smile, that's our signature. Yes. Happy? Right? Yes. You can see the new faces, they will smile here. Where are you from, Samsana? Am I pronouncing it correctly? Samsana. You have to smile.
Good morning, sir.
Yes.
Good morning, sir.
Good morning.
From UK.
Right. Okay. If you have a second instrument, see that the sound is lowered, okay? Sound is 0 or mute the sound. The second instrument. Second instrument, make sound nil, 0. It's good to have say, 2 instruments so that you can zoom and zoom in and attend the sessions and see the screens better. When it is small in letter, always try to get connected to 2 instruments. One can be connected to YouTube so that you can interact with the comment space. Other one could be, if you're in the Zoom classroom, get it connected to Zoom classroom so that you can zoom in YouTube screen and watch the videos and listen to the session. And now, one thing what I want to tell you, how many practice materials we have at OET official website for reading, OET reading? Any idea? Have you ever visited? You can type in the YouTube comment space. How many practice materials we have?
10.
35. Is that enough? Is that enough?
Yes, Father.
Yes, Father.
Yes, Father.
More than enough.
Yeah, but then they are supposed to be mock tests, like, you know, in the sense, now, if at all you require more of the practice materials, definitely OET should have provided. Because OET definitely knows there aren't competent people who can prepare material, OET authentic materials for the students. It's going to be very expensive, even if there are competitive people. So more 5 materials more than sufficient. But practicing doesn't happen only with the materials. You have to develop the overall competency. That's why we stress on paragraph structure and other things. It's not basically to tell you what is the paragraph structure, but to develop the analytical skill in reading. How to identify the basic idea, main purpose, all those details. Yes. I think senior engineer has some background history. I think that's some. Just mute only when you speak. Yes. So let me share my screen. Keep chatting. So today we'll be looking into so screen visible at YouTube. Okay, right. Yes, 5. Yes. 1. Is the screen visible at YouTube? Just type in S or Y. Thumbs up. At YouTube, I am waiting for your response. Just type in if it is visible at the am I not getting the message immediately? Yes, I'm Saleen says yes. Thank you. Yeah, sometimes say yes, Father. Okay, reading part B. Okay, let's check. Before that, this was is the full screen seen in the YouTube comment space? Those who are at Zoom class can respond. Because there is a daily meeting. At Zoom, just check whether the full screen is available on YouTube line. Because I can't see here. No, right? Am I audible at a Zoom classroom?
Yes, Father.
Yes,
Why
Father.
don't you respond?
Yes, Father.
The screen
Is
is
the full-
visible, Father. Full
Is the full
half
screen?
screen. No, Father, half screen.
Yeah, since 1 sec, give me 1 sec, yeah. Let me check if I can change this.
Father, your voice is not clear sometimes.
Not clear?
Yes, Father.
I'm trying to correct the screen position. Okay. There are difference now.
Noted, sir. Now it's okay, sir.
Okay.
Uh,
Was it okay? No. people don't convince. Thanks. Till the problem exists, right? Okay, we'll set it right later. You can read, right? Try to zoom it, okay?
Yes,
I'm
Father.
not very able to rectify it, yeah. Now, was there any doubt regarding this? What is the topic sentence?
Diabetes mellitus is a chronic condition that requires careful monitoring and long-term management.
Yeah, diabetes mellitus. Yeah, this is the topic sentence, right? So what are the controlling idea?
Careful monitoring and long-term management.
Monitoring and
Long-term management.
Management.
Yeah, or just monitoring and management will be good. Long-term management, careful monitoring and long-term management, or monitoring and management. Now, this has to be explained in the following sentences. What is the supporting sentence?
The patient has been advised to maintain a balanced diet and to engage in regular physical activity to control blood glucose levels.
Yeah, what are these things? Management or
It's
monitoring?
management. Management, Father.
Okay, management. Management is explained. Then next, that is supporting sentence. This is topic sentence. Yes. And this is a supporting sentence, right? Then
Developing sentence.
is it developing sentence? Does it give some illustration example? You know, what is topic sentence? Introduces the main idea. So if they ask for main purpose, main idea, gist, all those questions will have answers in the topic sentence. Can you see me? My power failed. Hope it will be cool. Yeah. Yes. You can see me, right?
Yeah, see, Father.
Father.
Let me check if I can give it a little light. One sec.
So need to admit again.
If they are active learners or special batch, if they are late.
Okay.
Not supposed to be when you are late. Some excuses because nurses are always busy. Okay. Hope power will come back. So topic sentence is main idea. So you know whenever they ask about gist questions or the purpose or the main purpose, what is the main idea? The answer will be in the topic sentence. Supporting sentences provide key information about the main idea. That explains the main idea. Developing sentences add explanation, examples, or importance. Do you have what you said? An explanation or examples or importance of the supporting sentence. Concluding sentence summarizes or reinforces the main idea. See, topic sentence and concluding sentence one each. Supporting sentences and developing sentence can be any number. 2, 3, 4, no issues. Okay. So here, management, if management is given in one supporting sentence, there should be something. Or management again, medication compliance. What is it? What is it? Do you require medication for management? Is it monitoring or management?
Monitoring.
Okay. Monitoring if you want to say
The treatment. Treatment, Father.
No, here among monitoring and management is the key sentence. Where does it connect to? How do you manage diabetes?
With the balanced diet and physical activity.
Balanced
And
diet, physical
medication.
activity, and medication.
And medication.
Yeah. So This is again supporting sentence 2. This is supporting sentence 1. This is supporting sentence 2. Why? Because it is speaking away, explaining the topic sentence. These two sentences explain the topic sentence. How do you manage diabetes? Then what is next?
Regular follow.
Sentence.
Regular follow-up appointments. Okay, then are recommended to assess the effectiveness of treatment and to make necessary adjustments. Patient education. For what? Promoting self-care and improving overall health. Okay, so we can put it like this. Topic sentence: diabetes mellitus is a chronic condition that requires careful monitoring and long-term management. Supporting sentence: the patient has been advised to maintain a balanced diet and engage in regular physical activity to control blood glucose levels. Medication. Supporting sentence 2: medication compliance is essential to prevent complications such as neuropathy, retinopathy, and cardiovascular disease. Developing sentence: regular follow-up appointments are recommended to assess the effectiveness of treatment and to make necessary adjustments. Conclusion: patient education plays a vital role in promoting self-care and improving overall health outcomes. How do you connect that conclusion with the other sentences? We said conclusion means summarize or reinforce the main idea. How do you connect? Does balanced diet improve overall health? Does it help? Does regular physical activity promote overall health or improve overall health? Does medication compliance improve overall health? Yes, all these are summarized into the conclusion. Let's check one more small paragraph so that we are clear about it. Yeah. Somebody please read and identify the topic sentence supporting the developing set of sector. Yes. Can read loud.
Postoperative care. Postoperative care is essential to promote recovery and prevent complications following surgery.
Yes.
The patient has been, it's a controlling idea for the, it's a topic sentence.
Is the topic sentence, and promoting recovery and preventing complication is the controlling idea.
Controlling idea. The patient has been advised to keep the surgical wound clean and dry to reduce the risk of infection. The supporting sentence.
Yes.
Pain management should be followed according to the prescribed medication schedule.
What sentence is it? Anyone?
Supporting sentence 2.
Just try. I'll change later. Don't worry. The patient
Should avoid strenuous activities until complete healing has occurred. Follow-up assessment is necessary to monitor progress and ensure optimal recovery.
Okay. So promote recovery, optimal. Promote recovery is here.
Recovery.
Optimal recovery. Okay. So that is a summary of the topic sentence. So topic sentence is post-operative care is essential to promote recovery and prevent complications following a surgery. Supporting sentences, you are right. There were two supporting sentences because one was stating about keep the surgical wound clean and dry. Second one says pain management should be according to the prescribed medication schedule. Then developing sentence, the patient should avoid strenuous activities until complete healing has occurred. Concluding sentence, follow-up assessment is necessary to monitor progress and ensure optimal recovery, which means promote recovery. Is that clear?
Yes, Father.
It takes some time.
Yes, sir.
By practice, it will get clarified. The more you think in this line, it becomes very easy to identify the answers. Okay, and later on will be why I force you to watch those 1 to 40 episodes, the videos, very small videos, 3 minutes to 10 minutes each video, because you'll be asking the same questions repeatedly. If you don't understand this, when I say main idea is in the topic sentence in the following sections, you will not understand what is topic sentence. Okay, or the answer is in the supporting sentence, or inference questions, the answer is in the concluding sentence, or illustrate or explain, such words are used, the answer is in the developing sentence. All those things will be connected to this. So let's go to reading part B, question 1. Okay, the code of conduct applies to hedging words, keywords, louder, smiling.
Code of conduct.
Yeah. Okay.
Applies
Applies to
to.
Yeah. Main keyword is applies to whom?
Yeah.
Applies to whom is the
Whom.
main keyword. You have to find out to whom does it apply. Okay. Doctors, friending patients on Facebook, privacy settings. Does it apply to privacy settings?
Electronic and face-to-face
electronic and
communication.
face-to-face communication.
There is something, there is a friend, what is it? What is this?
Conjunction and
And once you are competent, you will straight away choose this answer.
And
Because one of the 7 principles, don't believe me, one of the 7 principles of elimination, if you have watched my video on elimination, says the longest answer has 90 plus possibility of being right. Longest answer option. Not only that, what is that called? And how do you call it?
Fanboys.
Yeah,
Fanboys.
fanboys. Okay. Fanboy is there, so that must be the answer. Don't believe me? We'll see. Now you see what are the differentiating this one? Hedging words.
Facebook,
Facebook, social media,
Social
social
media,
media,
and
face-to-face
electronic and
communication.
face-to communication. Both electronic and face-to-face. A is particular 1, B is 1, C is 2. When there are, even in reading part C, when there is 1 singular and 3 plural, singular will be the answer. And if there are 1 plural and 3 singular or 2 singular, plural will be the answer. Plural will be the
is the
answer.
answer.
Now, code of conduct applies to whom? Only people, those who interact in the Facebook doctors. Code of conduct applies to only those who use social media, never meet patients. It's absurd according to your medical knowledge, right? Code of conduct is for real life. So it can apply to both. Mostly to face-to-face communication, but also now, since digital era, to electronic communication. Let's read. Yeah, somebody please read.
Professional
Anyone, please.
obligations.
Yeah.
The code of conduct contains guidance about the required standards of professional behavior, which apply to registered health practitioners whether they are interacting in person or online. The code of
What is
conduct
that?
of
That is the
the topic
there.
sentence.
That is the topic sentence. Still here it is a topic sentence. And what does this speak? Does it have any similarity to any option? Whether they are it applies to health professionals, whether they are interacting in person or online.
C level.
C for the
C for
Yeah, electronic. In person means face-to-face communication.
Face-to-face.
Online means electronic.
electronic.
Yes.
Only thing they will change the order. In the option they have given electronic first and then face-to-face communication. In the topic sentence they have given interacting in person, face-to-face. That is called synonymous language.
Yes, Father.
So do you need to read the rest?
No,
The
Father.
topic sentence
No, Father.
itself, topic sentence itself says this applies to both professionals, registered health practitioners who are interacting either in person or online. That's why I said unless you are thorough with the topic, paragraph structure, that is the basic crux of all the benchmark English exams. Okay. Now, anyhow, let's read it. We don't require it, but then we'll read. Okay.
The code of conduct also articulates standards of professional conduct in relation to privacy and confidentiality of patient information, including when using social media. For example, posting unauthorized photographs of patients in any medium is a breach of the patient's privacy and confidentiality, including on a personal Facebook site or group, even if the privacy settings are set at the highest setting, such as for a closed invisible group.
Okay. Now you see, next sentence speaks about what does the code of conduct articulate? What does it say? The question Sharma is asking, it applies to whom? But next sentence is saying, what is it? What is the content? What does it say? Articulates. Then gives examples. The question Sharma is not asking what is the content of the code of conduct, or the question Sharma is also not asking, give some examples of code of conduct. The question Sharma is simply asking, whom does it apply to? It applies to doctors or registered health practitioners who are interacting in person or online, who are interacting electronic and face-to-face communication. Is that clear?
Yes,
So
Father.
actually in the examination, how you kill the time? Because you may not require to read this at all. Because clear answer is given in the first sentence itself. And before that, I said, if there is a fanboy, I think you are not happy because boy is there. If it is fan girls, you would have been happy, right? Okay?
Yes,
Fanboy. If there is a fanboy, I'm telling you, these are the very simple, very, very tactful things. It's not the hard work, but majority, 99% of the OET aspirants struggle and suffer and fail to get the score because they do the hard work. Here, there is no hard work, only smart work. You have to gamify the learning process. That's what we are trying to tell you. Okay? It's not that easy. As soon as you take next text, you may not understand it, but try to do it. Find if there is a fanboy, try to allocate that answer in the passage. Okay? Is that cool?
Yes, Father.
Yes, Father.
So this is fanboys. Or and no, but or yet so. Right? Some newcomers. 2, 1, 2, 5. Yeah. These are known as F stands for for, A stands for and, N stands for nor, B stands for but, O stands for or, Y stands for yet, S stands for so. These are known as conjunctions, connective words. And in the previous part A reading, you have seen more than half of the answers were using fanboys. Okay. So applies to register and practice whether they are interacting person or online. How beautiful. Okay, we may not go in detail or, but we'll see. So question number 2. Why does dysphagia, am I pronouncing it correctly?
Dysphagia.
Yes, sir.
Father.
Dysphagia
Dysphagia.
often require complex management. Why does dysphagia often require complex management? Why? Why means
Reason.
reason, right?
Reason.
Because
Reason. Reason must be the answer. And all the 3 options has got because.
Because.
So you need to highlight it. If all the 3 options has something, if you're differentiating or concept based words, you need same words, you need not highlight it. Because it.
C
Okay.
is absolute, Father. Absolute.
B is because
C.
it. Which one? C.
No, C is absolute.
Is it seldom
Seldom.
absolute?
Without other options.
Yeah. Seldom occurs without other. Seldom is
Scale.
Absolute.
without the other symptoms means.
Without other symptoms.
Is it absolute?
No further.
Other symptoms, there is some other symptoms, right?
Yes, sir.
So seldom is not absolute. Okay, seldom. Always. Sometimes. Seldom. Never. Seldom means few times. Not 0. Okay. And as I said, if there is such options, that's the trick, and that must be the right answer. If the absolute, some sort of absolute meaning is mentioned, then it is, if the meaning is not absolute, that must be the answer. Don't believe me, okay? Don't believe me. If there is absolute expressions and if the meaning is not absolute, that must be the answer. So according to that principle, this is the answer. But don't believe me. I'm just highlighting.
But
Okay?
Father, the B option, the fanboy is conjunction and is here.
Yeah. Because
Because
it is difficult, contrast, complex, and non-complex.
And
Among the 7 principles, there is one more principle which says an option with the grammar mistake will never be the right answer. An option with the grammar mistake will never be the right answer. Is it correct? Because it is difficult, contrast, complex, and not complex. The sentence itself is not correct. Precise language is not used. Precise language is not used. As per the 7 principles which I have given in the elimination method video or session, this is wrong because this is not using a correct language. Fanboy is there, but the grammar is wrong. Is the grammar right? Because it is difficult, contrast, complex, and not complex. At least difficult to contrast, something must be there, but this is absurd. Grammatical mistake. If there is any option with a grammar mistake, that will never ever be the right answer. Whether fanboys are there, absolutes are there, or not there, or anything. Those are the 7 principles of elimination. And precise language, use of precise language is a must for right answer. Is that cool, Ranjini?
yes, Father.
Okay. And if you others have some doubt, please watch that video on elimination method. Okay, Mini Jackson, you can remind the chief admin to post it, okay?
Okay,
In
sir.
the main platform and all other groups here. Elimination method, maybe old video, but the session you can see. Because it negatively influences the cardiac system. Negatively influences the cardiac system. Because it seldom occurs without prior symptoms. Other symptoms, okay. Don't believe me, just let's read. Yeah, someone. Hello. Right, these are the opportunities you get to build up your confidence, okay? Confidence is very, very essential. Make mistakes, no problem. Even I am making mistake, you know. You taught me how to pronounce dysphagia. I don't know. I don't feel anything bad because this is medical terminology. I need not know all the medical terminologies. Yes.
Can I read, Father?
Anyone.
Yeah. General principles. Dysphagia management may be complex and is often multifactorial in nature.
What is this?
The-
This sentence?
Multifactorial
Topic
in
sentence.
So
nature.
what is this
Sentence.
sentence?
Topic
This
sentence.
is the
Topic
topic
sentence.
sentence.
Topic
What does it
sentence.
mean? Multifactorial in nature. What does it mean?
Controlling.
Controlling.
Multi-factor. Other symptoms.
Multi
Many symptoms.
symptoms.
Multi-symptoms. Other symptoms. Multifactorial in nature. That's why I said once you improve your language competency, which happens, it doesn't. You can't buy hard. You can't buy hard the competency. As you go on practicing, as soon as you read the topic sentence, you know third option is the right option. Management is complex and is often multifactorial nature. The third option says seldom occurs without other symptoms. That's the
Seldom
paraphrasing
means
of this.
yeah,
Seldom means
often.
sometimes, very rarely
Something.
occurs without other symptoms. Which means most of the time it is multifactorial. Other symptoms also go along. And that has to be explained in the next sentence. Come on.
The speech pathologist's understanding of human physiology is critical. The swallowing system works with the respiratory system. Thus, respiratory system is in turn influenced by the cardiac system, and the cardiac system is affected by the renal system. Due to the physiological complexities of the human body, few clients present with the dysphagia in isolation.
Few means what?
Few
Zero.
means zero.
No clients present dysphagia in isolation. Same, that is the paraphrasing of topic sentence. There's one paragraph, right? First one is one paragraph. There are two paragraphs now here in this text. First paragraph, often multifactorial nature. Few clients present with dysphagia in isolation. Means without other symptoms, you don't meet any patients. Do you understand it?
Yes.
Now this you see, because it seldom occurs without other symptoms, it may be complex and is often multifactorial in nature, and few clients present with dysphagia in isolation. All these three are same, paraphrasing. Third option, topic sentence and the conclusion. And once you know this topic sentence, you need not read the whole paragraph. If you don't understand, the conclusion says again the same thing. Do you need to read the other thing?
No.
Next paragraph?
No, Father.
No need, because that is speaking about the complex versus non-complex cases, differentiation between complex and non-complex. No option is speaking about differentiation. One option speaks about difficult contrast complex, but that is grammatically wrong option. Did you get me?
Yes, Father.
Yes, Father.
Now you see, this is the paragraph structure. This paragraph, topic sentence, then concluding sentence, paraphrases the same. See this? How beautiful. Dysphagia management, multifactorial nature. Few clients present with dysphagia in isolation. The topic sentence and the conclusion. Paragraph structure. You have to go through those paragraph structure videos. There are more than at least some 6 or 7, where I have shown you all these diagrams, 4 types of paragraph structures. But you have only first and second type in your OET. Third and fourth, they very seldom occurs in your OET text. Mostly you have first type, then you have like this second type. Okay? So which is the answer?
C.
C is the
C is the
Answer.
answer. And we selected it first itself. Then Rajini objected saying fanboy is there, but fanboy is with the bad friends. Okay? They should be with the good friends. Fanboy should be with good friends. Don't you feel that when you read it is wrong? Because it is difficult, contrast, complex and non-complex cases. Doesn't make any sense. Non-precise language. Do you have stamina to go on?
Yes, Father.
Yes, Father.
Yes, Father.
Yes, come on.
Father.
Yeah, the main point of the extract is, okay, option A, how to find documents about infection control in Australia. Find documents. That dental practices must have a guide for infection control. That dental infection control protocols must be updated. Okay? Is that cool?
Okay.
Yes, Father.
Yeah, now read. Come on, fast. Anyone? Don't waste time.
Documentation.
When you delay, I lose my energy. Okay, do it fast. Yeah. Yes.
Documentation. Every place where dental care is provided must have the following documents in either hard copy or electronic form.
Yeah.
The
Now
lab
every place means every place from versus Australia.
General words particular.
Yeah. So can it be only Australia?
No.
Every
No.
place. It can be India,
Every
UK. So as soon as you read that every place, you can eliminate this. Okay. It's not Australia. It's every place where dental care is provided. Whether it is in Uganda, Africa, America, UK, every place. Okay. Documents in either hard copy or electronic form. Any idea?
C may be the answer.
No. Every place where dental care is provided must have the following documents in either hard copy or electronic form. The letter to the every working dental practitioner and all staff must have access. Every working dental practitioner. Is it only those in Australia?
No.
Okay. So every staff. Does it speak
All
anything
over the
about
world.
topics and it speak anything about updating? Updating means it has to be improved. It is not okay. Now, even if you have access or not, it is no use because it is not updated. Outdated. Is outdated to prepare medicines useful? So also outdated documents or any this one manuals, are they useful? Does the topic sentence speak anything about being updated or must be updated?
No, Father.
It says
No
must
updation.
have
Yes.
access to.
Mm.
But there is nothing speaking about updating. Every place where dental care is provided must have the following documents in either hard copy or electronic form and accessible to every working dental practitioner and all staff. Which means the topic sentence is not speaking about updation at all. If it is not updated, what is the use of having it? So in that sense, if you understand, you can immediately eliminate, because if the topic sentence is not having, don't believe me, just go on.
Yeah,
Yeah,
a manual
continue.
setting out the infection control protocols and procedures used in that practice, which is based on the documents listed at sections 1, B,
Okay.
B, C, and D of this guidelines, and with reference to the concepts in current practice noted.
Yeah.
In the
No.
documents listed under references in these guidelines. The current Australian Dental Association guidelines for infection control available at.
Okay. Now, does it speak anything about updation?
No, Father.
It's not given. Third option is not given at all. Not in a single word mentioning updation. Correct?
Yes.
The dental practices must have a guide for infection control. This is the gist question, main point. Gist means they are saying every place, every dental practitioner, all stuff must have access to what? Access to a document for infection control. And manual setting, internet access should be there. Everything should be available to all dental practitioners. All this stuff. This is known as gist-based question. Okay. This will give you more than 10 marks. Okay. Question number 4.
Father, every main
Yeah.
point will be the gist type.
Every main point.
Yeah, in
Yeah,
the
main
question.
point. Main point.
Okay.
And the purpose usually gist question. Whenever main point is mentioned, that is the gist of the. And most of the first questions are gist questions in your reading part C. Most of them, not all of them, most of them. First question in your reading text, both the texts, first question usually is a gist-based question. And that gives you more marks than the normal question. That's why we have 500 marks and 40 questions. Okay, here, fourth one. Shall we go on? I think you have no energy. And
No,
YouTube,
Father.
no idea, no
No,
message.
we have energy, Father.
But YouTube, the chat rate has gone down to 1, which means no energy. There should be chat going up. Then only we'll see a chat rate. Otherwise, my energy will be dropped. Come on, send some messages at YouTube. Let's create some energy there. Yes, only Dorothy, Valli, and Jayabila are the people who love Edu Skills and type in something in the. Okay, Josina and Joy also doing it. Who else? See, you can see them. Kinjal is doing, but very rarely. Dorothy is doing repeatedly. Yes. See, you don't lose anything, right? Just by sending a message. Even you don't want to do that. So selfish. See, the more the message, it reaches more people. And I'll get some energy when I see that hearts and emojis. Come on. Chat rate is 1 now. It has to go to about 10 at least. Everybody type in. Type in anything that you love from this session. 1 sentence. Or anything, any tagline, anything. Yeah, emojis. Love. How come you become so neutral? Huh? Without response, the classes are very challenging. Okay. You'll understand when you take sessions. I must make you take 1 session each, then you'll understand what is the challenge when you take online sessions. Yeah. All the emojis interactions must be at the YouTube comment space. I can't access the Zoom classroom comment space. Yeah. Chat room. Chat box. We are improving further, yes. Okay, yes, I'm so energetic and OET, yes. Very educated, yeah. See, chat rate has gone to 30. Why can't you keep that? It was 1. Chat rate was just 1, now it has gone to 30. You have to keep it in 30. In between, you can type in something. Whenever I ask you some questions, type in something. Okay. Going good? Yes. Yeah. And the chat goes down. If it comes to 1 again, I will stop immediately. That's the signal that you are exhausted. Okay. Come on. Shall we go to a 4th question? Hello. Amanpreet, you are
Yes,
not
Father.
smiling.
Yes, Father.
Yes, Father.
Okay. Yes. Negative effects from prescription drugs are often. Keywords, setting words.
I was busy to read the topic.
Okay. Negative effects. What are the heading words? Tell me fast.
Negative effects,
From
Negative
Prescription drugs.
prescription drugs,
Let me check. One check. My YouTube got disconnected. That's it. I don't know. Reload. Yeah, it's very good. Yeah, okay. Okay. Now, negative effect resumed as often. Often is important, right? Okay, negative effects from the prescription drugs are often. Even prescription drugs, if you want, you can underline, but then that is the whole thing. Option A, avoidable in young people.
Avoidable.
Avoidable.
people.
And young
Okay,
people.
young people as well.
Unpredictable.
Young people, yeah. Differentiating. They are known as differentiating concept based. Unpredictable in the elderly.
Unpredictable,
Elderly.
elderly,
Elderly.
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 Miscommunication.
Caused by
Miscommunication.
Caused
miscommunication.
by miscommunication.
Communication.
Okay. Now heading says reasons for drug-related problems. Manual for geriatric. Reasons. What does it say? I said headings are always important. Reasons. Headings are very, very important. The heading gives you the crux, the smell, the taste, flavor of the paragraph text. Now the heading is saying reasons for drug-related problems. Negative effects from prescription drugs. Any clue to any option?
Yes. B for the geriatric specialties is elderly.
Manual for geriatric specialist. Now I am asking reasons. Does reasons connect to any of the three options? Any
C.
synonym?
Cause.
Cause.
Cause, yeah. Cause is the
Cause.
synonym of
Reason.
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 And the heading principle, when you are competent, you know, heading principle will say this is the right answer. Because the other two doesn't speak about reasons at all. But don't believe me, we will check it out. Okay? Because reason, the heading is only in the third one. Okay, come on, read.
Reasons for drug-related problems. Manual for geriatric specialists. Adverse drug effects can occur in any patients, but certain characteristics of the elderly make them more susceptible.
So that is
For
the
a-
topic sentence.
that is
Now
topic
come on,
sentence.
what is the gist of that topic sentence?
Adverse
Adverse drug
drug
effects can
Adverse
occur in any patient.
Any patient, but
It can be
certain
young, elderly, or children, or
or-
anything. But certain characteristics of the elderly make them more susceptible. Okay, adverse drug effects synonymous of negative effects from prescription
Yes.
drugs. Synonymous of negative effects from prescription drugs. Okay, continue reading.
For example, the elderly often takes many drugs, polypharmacy, and have age-related changes in pharmacodynamics and pharmacokinetics. Both increase the risk of adverse effects. At any age, adverse drug effects may occur when drugs are prescribed and taken appropriately. For example, now new onset allergic reactions are not predictable or preventable. However, adverse effects are thought to be preventable in almost 90% of cases in the elderly, compared with only 20% in younger patients. Certain drug classes are commonly involved: antipsychotics, antidepressants, and sedative hypnotics. In the elderly, a number of common reasons for adverse drug effects, ineffectiveness, or both are preventable. Many of these reasons involve inadequate communication with patients or between healthcare practitioners, particularly during healthcare transitions.
Okay. Any idea?
Reason, cause, inadequate communication.
Yeah, I know. Inadequate
Communication with
Communication.
patients or
caused
between
by
health.
miscommunication. Caused by miscommunication. Now the problem is unpredictable in elderly. There is something here preventable in almost 90% cases in the elderly. What do you say? Looks same, right?
Opposite.
No? Looks same, right? Second option.
It's unpredictable, sir. It's a preventable.
Okay, it sounds almost the same, but that is the trick they play. Preventable is not unpredictable.
Yes, sir.
No?
Hmm.
Preventable is not unpredictable. Unpredictable means you can't say, you can't predict anything. Preventable means there is sickness, you can predict, no problem, but you can prevent it. Okay, so some tricks they play. So here it is in the conclusion. That is answer is in the conclusion, concluding sentence. And one policy tells you contrast word is there, so the answer must be after that.
Yeah.
Okay, so you can concentrate more here. Yes. That is cool. If it is cool, type in cool in the comment space. Chat rate has gone down to 6. Yeah. Cool, type in cool. Type in love. Yes. No cool coming. Yes. Yes, Sini Abraham. Yes. Super chat. Thank you. Yes. Yerula Harsh. Yes. Okay. Okay, question number 5. Okay. The guideline tries to use terminology that heading words.
Guideline.
Guidelines.
Use
Terminology.
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 Option A presents value-free information about different social groups.
Valuable pre-information.
Information about the different social
Different
groups.
social groups.
Second one distinguishes disadvantaged groups from the traditional majority. Prevents, distinguishes, and here clarifies.
Clarifies.
They clarifies the proportion of each race, gender, and culture. Proportion. Proportion means there should be some numbers, right? Percentage numbers should be there.
Groups.
Yes, come on. Anyone? Pass, vowel, smiling.
Terminology. Terminology in this guideline is a difficult issue since the choice of terminology used to distinguish group of persons can be personal and contentious, especially when the groups represent difference in race, gender, sexual orientation, culture, or other characteristics.
So that is the topic sentence. What is the tone of the topic sentence? Terminology in this guideline is a difficult issue. You may not understand very much because Indians, maybe if there are people from UK and other places, you might not understand this language. Because in India, you're saying somebody is SPSC is not a crime or you don't feel anything bad. But in European countries, saying somebody is black or white, racism, it is a criminal offense.
Yeah.
Okay, this passage is based on that. If you have that background, immediately you understand terminology in this guideline is a difficult issue. If the choice of terminology used to distinguish groups of persons can be personal and contentious. Means you cannot add some value to a group in your language. You can't say disabled. Now that's why they say specially abled or differently abled. Or you cannot say minority. It's an offense to say, but India it is cool. We cannot say what you call blacks or whites or something of that sort. So the tone is that it's very difficult. In simple words, the topic sentence is it is very difficult to give some value-free, present some value-free information. Means without attributing value to a group, it's very difficult to communicate. Okay, let's see. It's a bit challenging, I know, because topic is not familiar to me. Yes, continue reading.
Throughout the development of this guideline, the panel endeavored to maintain neutral and non-judgmental technology wherever possible. Terms such as minority, visible minority, non-visible minority, and language minority are used in some areas. When doing so, the panel refers solely to their proportionate numbers within the large proportion and infers no value on the term to imply less
Please.
importance.
Please mute others.
Infers no value on the term to imply less importance or less power. In some of the recommendations, the term represents groups is used again to refer solely to the disproportionate representation of some citizens in those settings in the comparison to the traditional majority.
Okay, any idea? Three options: presents value information about different social groups, distinguishes disadvantaged groups from the traditional majority, clarifies the proportion of each race, gender, and culture.
A
Means
for the value
he-
free.
Further option B.
Infers no
Louder, louder,
value
louder.
on them.
Type in at the comment space as well. I didn't get you, Mini Jackson.
Acha, on the A option, it's no value free information will be connected with infers no value on the time.
Yeah, but with that, here also they are saying maintain neutral and non-judgmental terminology.
Yes.
Neutral and non-judgmental terminology. Again, they are saying infer no value on the term. Value-free information. Value-free information means മലയാളം തിരിച്ചു വ്യത്യാസമില്ലാത്ത ഭാഷ, വിവേചനമില്ലാത്ത ഭാഷ. Something of that sort in Malayalam. Okay, it's not very cool for Indians. You don't understand because here minority is commonly used, majority is commonly used. But these are offensive languages as per many of the European countries. So the answer is option A, because they are not distinguishing disadvantaged groups from the traditional majority. There is no distinction given here at all. They are speaking only about the terminology. Heading is
Guideline about terminology.
Terminology. Here, guideline tries to terminology. So the gist also contains terminology. So it has to present only terminology. It cannot distinguish and clarify the proportion of each race. Does it say this race 30%, this race 70%, this race 20%, or this gender is 50%, that gender 30%? No. No proportion. Immediately you can, if there are no numbers, no percentage, such expressions can be immediately eliminated. Proportion, if there is a word proportion in the, because definitely proportion must be given in numbers, digits, right?
Father, but here it is written minority, like that, no?
Yeah,
Non-visible minority.
Yeah, visible minority. See,
That
non-judgmental
can be
minority.
proportion.
No.
Can be, no?
No, proportion must be in digits. What is the proportion of working health nurses in India? Can you say minority, majority? That's not the proportion. You must say this percentage or this data. All these numbers must be presented. Digital data must be presented when you speak of proportion. But non-visible minority is a single word. Visible minority is a single word. They are used as terms, one term. One single term. And terminology. Terminology. It speaks only about terminology, not distinction or clarifications. It's a bit challenging, I know. Don't worry. Anyhow, you can be satisfied with 490. Okay. You find it very challenging. Okay. 10 marks for the exam. I
Thank
know
you,
this
Father.
topic, this topic or language is not familiar to Indians. Not familiar to Indians. Here you boldly say a minority. We proudly say we are minorities, right? But it is an offensive language. To say somebody belongs to minority group is a offensive language. Okay. So A is the answer. Throughout the development of this guideline, the panel endeavored to maintain neutral and non-judgmental terminology wherever possible. Value-free information. Cool. You agree for 490, right? Yes.
Yes, Father.
Okay. So we'll proceed. What question number 6? Okay. What is the purpose of this extract? Purpose. Why did they write this extract? What is the purpose of this text? 1. To illustrate situations where patients may find it difficult to give negative feedback. To illustrate. Okay. Anything else?
Purpose.
Give negative feedback. Difficult to give negative feedback. Option B. To argue that hospital brochures should be provided in many languages.
To
To
argue.
argue brochures in many languages. Many languages. Okay. To provide guidance to people who are victims of discrimination. What is the purpose? Is it to illustrate that patients find difficult to speak negative things about the hospital nurses or staff health professionals? Or is it to argue that hospital brochures should be provided in many languages? Okay. Or is it to provide guidance to people who are victims of discrimination? What is the purpose of this section? Either to say patients find it very difficult to speak negative things. Okay. Or to say, to argue why brochures are not in our mother tongue. You go to Delhi AIMS and ask why the brochures are not printed in Malayalam. Okay. Or Tamil or Telugu. C option, to provide guidance to people who are victims of discrimination. There are people who are discriminated, so you give some guidance in this extract. Okay, special needs. Somebody, please.
Special needs. Special measures may be needed to ensure everyone in your client base is aware of your consumer feedback policy and is comfortable with raising their concerns.
Topic sentence. What does it say?
Ensure.
They don't feel comfortable. Now try to ensure every patient in your client base about the consumer feedback policy that you are not going to publish it. They are not going, that is not going to affect you in any way badly, negatively. We keep it confidential. It helps us promote or improve our services. And is comfortable with raising their concerns. The patient should be comfortable with raising their concerns about consumer feedback. Any connection with any option? Consumer feedback, feedback. Feel comfortable. Don't feel difficult about giving feedbacks. When you give negative feedbacks, we will improve our services. We'll keep it confidential. We will never reveal it. That's also you are not very familiar. If you are working abroad, you know what does it mean? Consumer feedback. Online platforms always. Option?
Option A.
Option A.
A.
Yes,
A,
definitely.
Yeah.
Nothing else can be, because that is the topic sentence. Feedback. Now, once you're confident, you will not read any more. See, feedback. And find it difficult. Okay. Here,
May
and is comfortable. Comfortable. Make them comfortable. Yeah, that's it. They find it difficult. Please make them comfortable. Explain to them. The sentence is saying, and is comfortable, ensure that they are comfortable with raising their concerns or giving negative feedback. Okay, read now. Yes.
For example, should you provide brochures in a language other than English? Some people are less likely to complain for cultural reasons. For example, some Aboriginal people may be cultural less inclined to complain, particularly to non-Aboriginal people. People with certain conditions such as hepatitis C or a mental illness may have concerns about discrimination that will make them less likely to speak up or if they are not satisfied or if something is wrong.
And again, I said, if you have a doubt, you have to look for repeated keywords or key phrases. If you watch my session on paragraph structure, the repeated keywords. What does it complain? Complain. Concerns about discrimination, not satisfied, something is wrong. Does it say negative feedback?
Yes, negative feedback.
Correct? All these words mean negative feedback. What do you say? Is there an argument about should be given in many languages? No, they are giving only an example. That's not the main argument. Just do you provide brochures in a language other than English? Can you think of? You can think of. But nobody is arguing there. There's a possibility to make them comfortable. So that they can give the feedback in their mother tongue. Complain, concerns about discrimination, not satisfied, something is wrong. So many languages, it's not mentioned, right? They're asking only a question, should you give more than other than in English? Correct. To provide guidance to people who are victims of discrimination, no guidance is given here. They have just mentioned their mental illness may have concerns about discrimination, may have a concern, but there is no guidance. That's not the
Even they
purpose of this.
mention make them less likely to speak. Find it too difficult.
See, where is it?
In last line, Father, make them less
Concerned about it.
likely
That
to
will
speak.
make them less likely to speak up if they are not satisfied or if something is wrong. But that is not a guideline for the discrimination, victims of discrimination, right? And purpose always will be mentioned in the topic sentence. Main idea, purpose will always be in the topic sentence. The topic sentence is telling, please ensure that every client, every patient is comfortable to raise their concerns or give their feedbacks, even negative feedback. Does it make sense?
Yes, Father.
Yes, Father.
How beautiful, how sweet,
Father, I
how
have
nice,
one
how
doubt.
nice.
Okay.
Please.
Like the option A, there's a may there, but in the topic sentence is ensure is the modal verb must, right? So how is there any problem with that? Like,
No, the problem is this. See, always make it a very, very correct point. Always I said, we are speaking about the hedging words or the modal verbs only in the question stem. When it appears in the question stem, otherwise never bother about modal verbs. Only if a modal verb appears in the question stem, modal verbs are to be looked into. Do you have a modal verb in the question stem?
no,
No,
don't have.
Father.
No.
No,
So
Father.
if there is no modal verb in the question stem, immediately modal verb principle is out of the court.
Okay.
Never ever
Yes,
think of
Father.
it. Never ever think of it.
Okay, Father.
And don't think of the other way about, don't eliminate the question stem because there is an absolute. Some people have done it. Father, there is an absolute in the question step. So I have eliminated the question step itself. So mark must be given to me by the OET, right? So absolute words are relevant only in the answer options. Modal verb is relevant only in the question step. If it is there in the question step, then in the answer options, then in the text, you have to look for. That will be the best clue for the answer.
Okay, teacher, thank
Okay,
you.
here they are saying special, you see, you have may here. Here also they have more modified the meaning. Special measures may be needed to ensure in your client base is aware of the consumer feedback policy and is comfortable with raising their concerns. Is that cool?
Father, this purpose question always comes in topic sentence answer.
Yeah,
Purpose.
definitely. If you can understand. Otherwise, you have to read the whole thing. Purpose, because when I'm speaking about, see, when I start giving a speech, I'll be definitely presenting the topic, right?
Yes, Father.
Yeah. For
Yes.
example, I am just giving a Mangala Shansa to Sini Kurian on her birthday. I'll start speaking about the birthday, right?
Yes.
Yeah. How much? Purpose.
Yeah, if I don't know about this idea, I will choose option C. Because of the the last portion also may have concern about the discrimination. So I just may over there and the discrimination in option C. So I just choose the answer as option C. If
See,
I don't know
now-
about this kind of information, I do.
Yeah.
I know it's
Yes,
wrong.
that is why I ask the people, please attend the sessions. Just watching videos will not be okay for you because you have got that competency to understand that. That's why I'm trying to make into episodes so that you are clear about each principle. Model verb, what does it mean? If it doesn't appear in the question stem, just forget it.
Yes, sir.
Why
Thank
we
you.
waste time? So also each principle has to be understood in its context. Otherwise, people will eliminate the question stem and say, good, I'm fine. Okay. Father has taught it. Okay. So that is known as little knowledge is dangerous. Okay. Little knowledge is dangerous. Okay. Yeah. Always, that's why I try to tell the people be consistent. Try to give a response, either in the comment space, in the platforms. At least I should know, right? Personally, I will not be able to read thousands of messages. But at least in the main platform, I can go and simply glance through sometimes. I do that so that I understand how much you have got it. What are your difficulties? Your problems are your difficulties and your problems are my syllabus. Okay? Your challenges are my syllabus. So you have to mention it. Not only that, here again may have concern who people with certain conditions such as hepatitis C or a mental illness may have concerns about discrimination. They will have some concerns about discrimination. If I tell them I am mentally sick, they may not accept me in their friendship groups. They are concerned, but the C is saying to provide guidance to people. It's not concern, it's guidance. Somebody else is giving. Here, what they have said, they may have concern means the mentally ill people will have, but the guidance, giving guidance is not there. Somebody else from outside.
Yes.
They're writing something to give them guidance, entirely different meaning. Don't worry, that you will get by practice, gradual practice. So learn
Thank
for
you. Life.
learn for life. Yes. That is it. If you have stamina, we can go on with something. I don't see. Chat with is 9. It's 1:30, there's number to 9. Energy is seen in the chat rates. Any other concerns? And please, even if you have watched, you have to re-watch the paragraph structure at least until you are able to see the structure in every paragraph. Especially in part C, listening and reading, both you have paragraph structure. Even in the listening audio, there is a structure. That's so beautiful. It takes some time for you to analyze. So take some time. Every day analyze one text, one question answer, the paragraph text. Try to do the analysis of the question and answer options. That's only the beginning stage. Later, you don't require anything of this sort. You will say too much time it is. Like somebody told me, he was attempting for the first time. He completed within 7 minutes, first 20 questions, part A in reading. Then she was reading again, correcting any spelling mistakes, everything. By then it was 9, hardly 10 minutes. Then 5 minutes left, right? She was sitting like this. Okay. Then the examiner was looking at her strangely, thinking that this Buddha knows nothing. Okay. But she got all the 20, she says, right in that part A within 7 minutes. Because once you know the tactics, it's so cool. Even these questions you don't require even 30 seconds if you know the strategies. Maybe 1 or 2 in the whole setup will have a little bit challenging, like where these questions are coming again. Come on. I'm ready with another CPAT, but your energy will not allow you, I believe.
No, we have energy,
No,
Father,
Brahma.
because Saturday is my exam.